Hi, I'm Dr. Sebastian Gonzalez with the Performance Place. The topic of the day is going to be hip labral tears. This is mainly going to be non-traumatic in origin. We'll talk about mainly the history involved with it, as well as some things you might feel in correlation with it. This is not intended to self-diagnose. You should definitely see somebody to figure out what you have. There's a reason why these conditions usually become undiagnosed for over 2 years. A lot of times it's a diagnosis of exclusion. The patient might feel some clicking and popping within the joint, usually the front or posterior region, but either way that's not indicative of the condition either. A lot of times the history involved will be like if we're talking about someone who likes to stretch a lot in regards to yoga, a woman might feel that they are able to stretch it out for a day or so, and then it seems like it comes back the next day. Women and men have two different types of conditions usually, and actually a lot of the times it can happen bilaterally. I'm going to show you guys some palpation tips on this, but actually there's not a lot of tests that are really good for labral tears. Alright, so now looking at an exam from the hip, mainly we're looking at a test, and honestly I forget the name of the test, but that really doesn't matter. So I'm mainly just going to push straight down, and we're going to rotate the leg backwards in internal external rotation, and you're going to notice in different ranges that she's going to have different feelings. Usually in this range here where it's an internal rotation, she'll feel a little bit more if she has more of that pincer type of labral tear, and you can even go down here to test different ranges as well. What you're going to find on these people usually is a deficiency in internal and external rotation. Usually with internal rotation, or this is you're gonna find, sorry, this is external rotation, you're gonna find usually about 60 degrees I think is normal. With internal rotation you want to find around 30, and one major goal that you should have with these people is that they should not necessarily be looking at decreasing the overall sensation of the pinching in the front here, but mainly that they should see the internal and external rotation is decreased, and that should be their goal, to increase that over the course of their training program. Women usually have a type called pincer type. A pincer type, and there's actually a lot of great illustrations on YouTube that you can use to better visualize this, because I'm not going to be able to show you on somebody, but usually it's extra. It's extra of the material, the cartilage within the labral area, which gets caught, or pinched as they call it. Guys usually have something called a cam deformity, which can be from some type of problem as they're developing, but it's an overgrowth of bone within the head portion of the femur, which seems to catch on the labrum and tear it as well. Traditional treatments for this, surgery is something a lot of people talk about with it, but in reality a lot of times if you take a person like this, get some MRI imaging as well, maybe an arthrogram, depends on what the orthopedic surgeon would want to see, but a lot of times they actually respond really well to conservative care, such as manual therapies, active release, deep tissue work, manipulation, stretching, and exercise really. You just have to make sure that you are straightforward with the patient and tell them this is something that can get really bad, and they're going to have flare-ups throughout their life with it, but realistically you can control it. There's no reason why you shouldn't be able to function as well as somebody else who has it. Thanks for watching. Hope you guys enjoyed this. Feel free to go on to our website and check out different videos on different conditions. We're always trying to educate and make sure that you guys really know more about your body.
Don't forget to check out our ebook at the website below.